All right, fantastic. There we go. And we are live with the one and only Dr. Jon Gardner. Jon, what's going on, man? So glad that you jumped on this morning with me.
I appreciate you having me, James. I've listened to the podcast since you started it, so it's a blessing to be able to pop on this thing and actually talk and act like I know what I'm talking about. So here we go.
I just play make believe every time we do one of these.
It's the best. It's the best. Fake it till you make it, right? That's what everybody tells me.
I told people when I first started this, it was really just an excuse for me to be able to talk with my friends for an hour and then call it work.
Exactly.
Just try to tap into that Joe Rogan system as much as possible. I'm like, bro, you made $100 million and you just sit around and like drink scotch and smoke weed and just like have awesome conversations with people.
Exactly.
Like, what am I missing?
Exactly. How did I not think about this?
Yeah, brilliant. But we wanted to dive in and talk about knee stuff today.
Absolutely.
Because one, we haven't talked a lot about the knee on the podcast previously. I actually don't know if we've ever actually like really talked about it. And so the people at Rebel that we're training are 25 to 50-year-old former high school, college athletes. They probably have a job and like they want to still maintain this total package, performance, physique, athleticism, and still live at their peak, right? And we end up running into issues with some of them where like we're having a hard time managing this. And we talked a little bit off air. We kind of have this prehab, performance, rehab realm where we're trying to blend these three worlds together so we can build this bulletproof knee that's happy, healthy, pain-free, performs at a high level. And so that would be really cool to have you on the show to chat about this because you're a physical therapist who wears all of those hats very well in terms of seeing high-performing athletes, training them for performance, as well as having to deal with more of that prehab, rehab world. Because you and I both know that those worlds are not separate. They are all meshed and integrated very tightly. So I think the best place to start before we dive into all the knee stuff, let's actually just give the quick elevator pitch on who you are, what you do.
Boy.
Give
Sure.
everybody the background on Jon, and then we can dive in and just kind of have a little coffee chat about knee goodness.
Yeah. So I'd be remiss if I didn't introduce myself as Jonathan Gardner. I tell everybody I'm Jon, but my mom will kill me if I introduce myself as Jon on the podcast. So I'm Jonathan Gardner. I'm a sports physical therapist and strength and conditioning specialist for True Sports Physical Therapy in the Maryland area. I am a regional director now, and I'm covering, if anybody knows anything about Maryland, I'm in like the Frederick, like the western side of Maryland, and then down 270. So I have another clinic in Gaithersburg, and then Bethesda, which is another suburb in Maryland, just outside of DC. I've been practicing physical therapy for, 3 years now. All mostly in the Maryland area. I started off at a nice outpatient facility that had sports in the name, but no sports actually coming into the facility. So then randomly found a job posting on Indeed, got hooked up with True Sports, and it's kind of been going from there. More background, I was a college basketball player at Coker College, now Coker University. Very fancy change. Small D2 school down in Hartsville, South Carolina, about 30 minutes out of my hometown in Florence. So played my 5 years there. I'm a basketball guy, so I've had the knee pain type stuff and ankle sprains and all that good stuff. So we'll dive into a little bit of that as we move forward here. But yeah, like you were speaking to, the whole goal of like True Sports is to provide the best holistic sports medicine approach to athletes, whether that's prehab, rehab, or just like some performance tune-ups and stuff like that. So that's kind of my space where I'm at now.
Fantastic, man. So what position did you play in basketball?
So I was like a shooting guard, small forward when I was in college. And then I think like the open court dribble drive offense started to really pick up like my junior and senior and fifth years. So then everything essentially became positionless, right? You're running your five best players on the floor, no matter a size. So like those traditional positions went out of the window. So I had times where I was bringing the ball up the floor. And then I also had times when I was guarding a guy who was entirely too tall. But other than that, mostly a shooting guard, small forward.
Okay, nice. I played up through my sophomore year in high school, and then realized that there just wasn't really room on the floor for like a high effort defensive player that really wasn't very good offensively.
Right.
Like,
right.
I was just athletic and I tried really hard, so it worked.
Sometimes that's all you need. I mean, in college, like my role definitely shifted. I went from, I think that's the nature of like college sports. Everybody was the best player on their team in high school, right? And then you get to college and these guys are like, you're not the best player anymore. So you quickly figure out what's going to get you playing time. Mine was becoming like the defender effort glue guy as opposed to like trying to be the 30-point per game guy anymore. So shifted that route pretty quick to get myself on the floor. So
yeah, you kind of have that like 1% adjustment from high school to college, and then another 1% adjustment from college to pro.
Oh, exactly.
And it's funny, you see it at every level. Like I can remember a football guy at our high school that was really good, a linebacker, and he went and played in the ACC. And I remember chatting with him and asking him one time like how things were going in like fall ball and spring ball and stuff like that. And he was like, it's like, dude, it's so fast. Like everything happens so fast. He's like, by the time I like read my key and I take a step, everybody's fucking gone.
Exactly. Exactly.
Like, and that's the thing that changes as you move up levels of sport. The speed at which everything takes place at is just it 10x's and 20x's. Like there's not this gradual increase of like stair stepping. It's an order of magnitude change from high school to college, and then another order of magnitude change from college to professional.
Right.
And yeah, the speed factor is just unreal.
Yeah, it's like I'm lucky enough to work with some like NFL, Major League, NBA guys, and like even like their ability to just like process stuff like in our sessions quickly, and like how in tune they are with everything that's going on around them. Like it's truly just bonkers. Like it's one of those things like where you see it, you're like, oh, that's why I'm not the pro, because I can't figure stuff out that quick.
Without question, man. So let's dive into the knee.
Sure.
And then the best place to start is let's just get a bird's eye view of this joint, right? Like,
sure.
Just a basic knee 101. Like, what is this joint? What's happening at the joint? What are some of our contributing factors? So we have this really interesting hinge joint here that tends to be really impacted by things happening both above it and below it. But I'll let you kind of give us the background in terms of how do we want to think about this joint just from a 101 textbook understanding potentially.
Sure. So, I mean, when you dive into the knee, again, like you're saying, like it's a hinge joint. So a lot of people think all it does really is like flex and extend and that sort of thing. So, I mean, you've got your basic tibiofemoral joint where your tibia is meeting that femur. And again, it's just giving you like that nice hinge. And then you've also got like the patellofemoral joint, and that's the one that'll give people some trouble. It's just where that patella is able to like glide back and forth over that trochlea that it sits on. So again, main movements are flexion, extension. However, you're also dealing with some tibial internal, external rotation, depending on which direction you're moving and stuff like that. So there's a little bit more involved with it than just flexion extension. But I mean, for the basis of the conversation, it's a flexor and extender. You got your quads, hamstring, calf, popliteus, bunch of little things running through that area. But for the basis of what we'll talk about, we'll just kind of stick with the flexion extension type stuff, unless you really want to dive into the weeds. So
yeah, exactly. Like, it's such an interesting joint because just from like a musculature standpoint, like you mentioned, like we have muscles that come up to the joint and then we have muscles that cross the joint. And it's like, there's this like layering effect that takes place almost.
Right.
And I always think of the knee in particular when we start having people complaining of knee pain.
Right.
And that could be a decent first place to start is, right, like we have this hinge joint. And like you mentioned, there is more going on there, but just kindergarten 101 level, it's just a flexion extension hinge joint.
Yeah.
And I always think about, I have this femur coming down on top, right? Tibia coming up from the bottom, etc. And we want these things to kind of mesh nicely. But what you start seeing with knee pain or dysfunction at that joint is when you end up with like torque at the joint. Right. It's like when these things aren't lining up well, like when one thing is going one direction and the other one's going the other, or it's like, it's this torque at a joint that's not really wanting to be torqued.
Right.
That is causing problems for people when we start getting repeated exposures and loading and velocity over time on that essentially underlying structure per se. Is that a fair sort of like assessment?
Yeah, I mean, I think that's the biggest thing. I mean, for me, like you constantly get these kids and adults coming in and seeing you, and the first thing they tell you, they're like, "Yeah, I got like tendonitis in my knee," and I'm like, "You probably don't." Like, if I'm looking at you and you come in and you make that complaint, unless you're a basketball guy, a volleyball guy, a high jumper, or a volleyball girl, like just a young jumping athlete, you probably don't have tendonitis type stuff. Like that's like you have to be able to load the tendon and almost overload it to get those kind of symptoms. And I mean, you can typically see pretty quickly when they come in, like you're not a tendinopathy kind of person. Like you don't participate in a running, jumping sport, like you're on a bike or you're having trouble with stairs, like very low load activity. So I think that's the first thing, like when you start diving into the knee stuff is it actually like a tendinopathy type thing? Or are we dealing with like your classic, like patellofemoral pain syndrome or PFPS or whatever people want to call it? And that's where you're starting to look at more of like the torque on stuff and stuff being quote unquote like misaligned or whatever the case may be. And that's where you have to really, that's where you do start to dive into the weeds, because it's not so much a, let's just get their quad stronger, let's just get their hamstring stronger. Like then you're looking at like, does their hip move well? Can they control their foot and ankle? Do they have enough sensation, like when their foot's on the ground, to like know where the pressure is, and like all that kind of stuff. So I think that's the first place to start, is whether it's a tendinopathy type thing or more of like your general patellofemoral pain syndrome type stuff that most people end up coming in with. And that requires a lot of education on my part to be like, it's not tendinopathy type stuff. Like we need to address some different stuff that's going to help with like this anterior knee pain. Because I mean, that pain like in the front of the knee that everybody complains about, that's like right on the tendon. Like there's studies that show like that's the most painful spot in people who have arthritis or people who have like fat pad syndrome and all that kind of stuff. So I mean, there's tons of different pathologies that can happen at the knee, even though it is such a simple joint, because like you were speaking to earlier, you have so much stuff happening above it at the hip, so much stuff happening below it at the foot and ankle, and then there's a whole coordination aspect of stuff as well.
Yeah, I'm really glad you mentioned because that's right, the PT for Dummies book. What you get, depending if you don't see a good physical therapist, you walk in with knee pain and it's like, oh, weak quads. Right. It's like that is classic old school PT for the knee. Oh, you have weak quads. Let's just go and just make that quad stronger and that knee pain's going to go away. I'm like, bro, like, and I think you said it perfectly, right? It's like, especially when you get athletes, right? Like our population are not going to be people with small quads. They're not going to have small quads. Like your quad is not weak. What's probably more likely happening, as you mentioned, I would love for you to unpack this more, is let's go look at what's happening at the hip and let's go look at what's happening at this ankle and foot, right? Because like those are the things that are actually going to be impacting above and below what's then taking place at a hinge joint, because the knee is kind of a dumb joint, right? It's going to do whatever's happening above and below it, essentially.
Right.
And so can you unpack that a little bit more in terms of, let's look at what's happening at a hip. Let's look at what's happening down at a foot and ankle and how that's actually then impacting this presentation of function or pain, performance, etc.
Sure. So, I mean, we'll start with, like, I'm a big foot and ankle guy as well. So we'll start down like at the foot and stuff like that. And you get these kids who walk in, and again, like I'm not one to like dive in and be like, oh, like this whole like kinetic chain thing, like you have bad feet, so you have bad knees, so you have bad hips or whatever. But I mean, there is something to be said. Like when you look at these kids and they have like either very high arches or they have very flat feet, and you're looking at that stuff and their ability to like control loads like with that foot and ankle complex. And if they've got no sensation of like where the pressure is in their foot, or like they have no calf, like that's a big thing for me. It's just general foot and ankle strength. Like you get these kids, again, like high performing athletes, and we have like age related norms for like calf strength. Like you should be able to knock out 30 reps of a single leg calf raise, like no issue, all the way up, all the way down, piece of cake. And you get these kids coming in and they're playing 8 games in a weekend, whether it's basketball, lacrosse, or whatever the case may be, and they can't do 10 calf raises before their calf's on fire. So then you're looking at that kind of stuff, and I'm like, well, you can't absorb force properly with your foot and ankle. So where do you think that stuff's going? And then again, you start adding in like over pronating and like collapsed foot or over supinated and stuff, and then you're changing like knee position with it, and they wonder why they feel it all up there. So I mean, that's typically the first place I will go, is looking at general like gastroc strength and then soleus strength as well.
So let me interrupt you super quick just while we're there, and then we can go to the hip.
Yeah.
What are some things that you like to do from a like protocol standpoint to help with this foot and ankle, both strength and then control, right? Because it is going to be a combination of both. And I think like that distinction between our people that are super high arched or the people that maybe have lost that arch and now are super flat footed. Like there's an element there of needing to regain calf strength, all those little intrinsic muscles of the feet. Right. And just being able to actually understand, like, where are you in space? Like when I'm on this foot, can I actually appreciate where I am in space and control position? Or am I the person that goes to stand on one foot and then I just see my entire foot do this? I just pronate, and then the tibia follows, my knee just goes, oh, okay. Like it just all collapses and internally rotates essentially. So what are just some basic ways that people can start working on that in their training, right? Like you can throw it into a warm up, or right, like back in the day at Cressy Performance, like one of the things we would do, like on a superset with a deadlift, we would give you like ankle mobs, or like little things like that, because like you're resting 2 minutes anyways. So it's an easy place for us to get more work like this. So what are some things people can do there to start helping with that ankle, calf, foot strength and control?
Right. So, I mean, the first thing that I'll have them do, and again, it's going to vary like level of the athlete wise.
Absolutely.
Like I provide as many constraints as I can to start off with, so that I don't have to over cue, I guess. Cause like once you start like telling these, like find your big toe, find your pinky toe, find your heel, like create that arch. Yeah. Like they're so lost. Like they don't have a sense of like where their foot is in space in general. So again, like I'll use more like physical constraints. Like I will put them on a slant board and have them what I'd call like an active foot or heel float kind of thing, where I just have that foot hanging off, and I'm like, you have to keep your foot parallel with the floor, but your heel has to stay up and elevated. And once we can like determine like where they're finding pressure in their foot and ankle and stuff like that, like then they can find their calf, and they're like, oh, like that's what that feels like. And then again, like you can change like the angle to slant. You can put them in pronation if they're an over supinated person. You can put them in supination if they're an over pronated person, like whatever you need to do from that standpoint, and just get them rocking and rolling. I'm not a huge fan of like the AirX pad foam stuff or the Bosu ball type stuff. Like the ground isn't made of foam and the ground doesn't wobble. So like this whole idea that you're going to recreate like ankle stability and strength by putting them on these unstable surfaces, you're just teaching them like bad compensation patterns, because all they're going to do is they're going to hide that foot and ankle, and they're just going to use their hip and stuff like that. So again, the biggest thing for me is like keeping them on flat ground and then making them more aware of like where that foot is in space and where they're feeling pressure. And then from there, then I'm sending those kids home with single leg calf raises. I'm sending them home with seated calf raises and basic stuff like that. Like it's sometimes it's just not as complicated as we try to make things. Sometimes it's like, you can't do 30 single leg calf raises, so let's go home and do single leg calf raises. And again, I think a lot of kids are surprised when that starts to fix, quote unquote, like their knees and stuff like that, simply by like figuring out like where their foot and ankle is in space, and like how to manage pressure and load and plyometrics, like with more foot and ankle strategy, as opposed to making everything knee and hip dominant.
Yeah, I'm glad you mentioned the AirX pad Bosu ball stuff, because that is just such a I don't spend that much time in that world anymore. So I just kind of assume like, oh, we're done with that, right? Like we've moved past that as a thing.
No.
Like 10 years ago when I was 22, 23, I was like, I was already like, this is dumb. Like, why are people doing this? I was like, I thought we've accomplished that. This is not doing what we wanted to do. I'm going to take somebody who already has a really hard time orienting and finding position in space. And then I'm going to put them on an unstable surface so that it becomes even harder for them to try to orient and find position in space. And they're just going to go into alarm mode, and they're just going to fall into some type of, like, they're going to find whatever reference they can, and it's not going to be the one you want.
No,
right?
Never.
It's like, I remember like way back in the day, I actually think Cressy's like master thesis had to do with unstable surface stuff and how it just was not. He's like, why are we doing this?
Right. Like you think you're challenging all these like foot and ankle strategies. And then the more you dive into like research on the topic, I mean, people just, they increase their hip strength and their hip control. Like their ankle doesn't get any stronger in terms of like force output or ability to absorb forces and stuff like that. They're going to, that's the thing about the human body. Like they're going to find a way to compensate. And again, I think that's part of like where this knee pain comes in and stuff like that, is your body is going to do whatever is the most efficient movement strategy. So if you don't have proper strength and coordination in certain areas, like your body's going to figure it out somewhere else. So that's when you start overusing quads and not finding your hamstring and not finding your calf and your soleus and intrinsics in your foot and like those little hip stabilizers and stuff like that. And instead, all you're going to do is use your giant lateral quad that you see on all these guys. And that's where we start to talk about like that little bit of like torque sensation on that knee, where it's kind of altering like path of like the patella on that trochlea a little bit.
Yeah, because essentially once you get somebody to a point where they have this baseline strength of being able to do the 30 calf raises, I can feel calf, I can actually kind of get pinky, big toe, heel, right? And in a very safe, very restrained, very watered down environment, then as opposed to trying to throw them on unstable surfaces, it's like, okay, well, now let's start to challenge that with either like loading or velocity, positioning. Like there's so many other places to go next for people, right? It's like, okay, awesome. Right. You can do this thing. Now, like, can we actually do this? Like, can you skip rope? Can you do jumps? Can you do like little single leg hops and actually like keep what we've started to maintain? Right. And you can work your way up in terms of the complexity and the demand or the intensity of what we're trying to do. Like, okay, cool. Can I drop from a 6 or 12-inch box and land in a good position and feel like that strong foot ankle complex do what it's supposed to do? Or when I do that, do I fall apart again? It's like, okay, cool. Well, we found our tipping point. Let's come back and figure out like what's a lower level sensation I can give you. Once we get that, then we can start to ramp up. It's like, there's just so many other tools you could use, right? Because eventually I want to be able to get you to say, okay, like, can we fully jump? Can we fully sprint? Can I have you come and cut in and out of turns and corners and have this maintain itself and not go back to this previous strategy that you were using?
Exactly. So, I mean, I think that's the biggest thing is you start with like as many constraints as possible, and then you gradually start to remove those and then make it more of like a coordination sport performance based type of thing. Again, like we were speaking to earlier, like it's not, more often than not, like it's not a strength issue. It's more like coordination and timing and stuff like that. So again, that's where the Bosu ball and AirX pad kind of go out of the window. Get it strong first and then gradually start to remove constraints and then work on more of the coordination aspect.
Yeah, right. Just like the basic progression is like, it has to be able to, just from like the safest standpoint, it needs to be able to absorb force, stop force, produce force, and then it has to be able to repeat that.
Exactly.
Like if we were going to make it as simple as we possibly can. And it's like the issue is most people totally ignore the first two. Right. And they just go straight to production and repeatability. Right. But the foundation that you've built this on is total trash.
Right.
Right. Like as a totally random other example, when I've spent a lot more time in the baseball world, you see this a lot with pitchers who would get elbow or shoulder pain. Mm-hmm. And then you watch them throw, you do table tests, you do things, and you're like, oh, well, like it's pretty obvious why we're getting shoulder pain, right? Like you literally can't move your scap. We get no upward rotation. Like there's no scapulohumeral rhythm. Like there's so many problems. But then they don't really work on those things because the team doctor is like, oh, well, we should just do surgery on your shoulder. And they go and get surgery. And then I'm just like, bro, your shoulder's going to hurt again. Give it 6 months, maybe 12 months. Like it's going to come, like you haven't fixed the underlying problem here.
Exactly.
Yeah, but that's
Exactly.
like another example, prominent example that you see
yeah,
a
very
lot.
much the same thing with like knees and stuff like that. Like sometimes it is as simple as like occasionally there's just a general strength deficit. More often than not, like somebody changed like the stimulus, right? Like they went from not doing anything over the course of COVID to all of a sudden be like, well, I'm going to start running. Or they used COVID to start running and they haven't run for years or whatever the case may be. So, I mean, it's a very multifactorial approach to the thing, like in terms of like the amount of load you're putting through it and all that sort of thing. But again, like just having systems in place to know what you're going to look at not only just the knee joint, but then the ankle and the hip as well to make sure that you're shoring all those things up is super important when you're looking at that knee joint. Because again, more often than not, it's not just a weak quad or a weak hamstring or whatever the case may be. It's a full kinetic chain, like coordination issue.
Mm-hmm. Yeah, the running one's funny because you see that here in Utah. You go drive up the canyons, like
Right.
legit canyons. And it's like you see people running up and down these things, and I'm just like, we're driving on the road, and I'm watching them run down. I'm like, bro, you're doing like a 5 mile down, like legit downhill grade, just like decelerated run. And I'm like, you don't even look like you run very often. This may be like the second time you've been out here doing this.
Exactly.
And it's like, and then you're going to be surprised when your knee feels like it got hit with a baseball bat tomorrow.
Exactly. Yeah.
Okay, so let's transition and go above the knee.
Sure.
And let's chat more some things going on at that hip complex and how that's potentially contributing. And then what are some ways we can maybe start to attack that as well?
Right. So, I mean, the biggest thing for me that I'm going to look at is like the ability to like get like proper hip rotation and stuff like that. So again, like I think in the PT world, particularly, like they're obsessed with glutes and external rotation and driving your knees out and keeping them out over your pinky toe and like all this stuff. But I mean, when you're in like a general like squat pattern, like your hip has to move from ER to IR to ER like constantly. So you've got to have both. So this whole idea that you're just going to work glutes and you're just going to work external rotators, like that's not necessarily the case by any means. So, I mean, I'm looking at, can they actively internally rotate their hip? Do they even have the passive hip internal rotation to like get into these positions? Because if you don't, then you can't put the proper stretch on the proper muscles. So then you can't fire them. And that's when you're starting to get into more like that compensation stuff, whether you're going to, again, your body's going to do the most efficient movement pattern it can to accomplish the task. So if you're not making sure that you're ticking those prerequisite boxes of like hip internal rotation and proper strength in like those positions, then it's not going to matter. You can cue knees out all you want. But that's a conversation for a different day. Everybody over cueing with mini bands and all this kind of stuff. Like again, like if it looks so bad that I can't stand to watch it, yes, I will come in and like recreate and like fix somebody's knee valgus, but like your hip has to internally rotate. Like your leg is going to rotate inward and pronate and all those things, like when you're going to do like an explosive jump and stuff like that. Like valgus, I think, is more of like a shearing type thing anyway. So like this idea that like your knees can never go in or they can never go like over your toes and your foot can never pronate and you can't internally rotate. Like that's very old school thinking, like your old classic like snap downs and like keep your knees out and squat and push your knees way to the side. And then again, those are the kids that come in and complain of like lateral knee pain or anterior knee pain type stuff. So again, making sure that they've got internal rotation and adductors has been a huge thing for me moving in the last, I'd say probably year or two, like finding those as opposed to just crushing hip external rotation as well. So making sure you've got the range of motion prerequisites, and then also just general hip adductor strength is super important. And then obviously the hamstring is super important in terms of like finding like true hip extension and not over using like lumbar extensors and stuff like that as well. So yeah, that's typically where I look, is like hip internal rotation, and then just general strength testing.
Yeah, because this is a big one. I hate the whole knees out movement, and it's still a thing, and it drives me insane. like, I guess that probably goes back to a lot of the Kelly Starrett CrossFit mobility WOD stuff, where it's like, all right, you're going to torque into the ground and drive our knees out super hard.
As
like, this
far
is
as
so
you can.
dumb. I'm like, one, if you can't internally rotate at the hip and you can't open your pelvic outlet, which is then going to come into what's going on with an adductor,
Right.
you will not be able to squat. You will not be able to squat well. You may fake your squat, but it's like, you also won't be able to go into a cut and come out of a cut because you have to be able to internally rotate and absorb force so you can then turn it around.
Right.
But for whatever reason, yeah, like there's this huge story of like, oh, drive your knees out and external rotation, external rotation. I'm like, well, if you put an athlete or even any of our people, like people that train, if you put someone that actually trains on a table, here's what they're going to be missing 99% of the time. They're not going to have IR, they're not going to have extension, and they're not going to probably have the ability to adduct. They're going to be really good at AB ducting, and they're going to be great at externally rotating.
Yep.
And then we just pile more of that on. And it's,
Exactly.
what are we doing? Like, we got to fill the empty bucket. Like, this is what they need. So if we think about trying to reclaim some of that for people,
Sure.
what are some things that people can do? Because like, if you're listening to this and you're still in the knees out camp, please, for the love of God, just stop. Like, even if we just want to think about a squat, it makes no sense. I'm trying to put force into the ground so that I can push myself back up.
Exactly.
Why would I want to drive force rotating laterally when I'm trying to put force straight down into the ground? That's like, okay, I want you to jump as high as you can, but I want you to think about trying to push your feet out to the side when you do so.
Exactly.
It's like, that's so stupid. Okay.
I know. And then they wonder why they come in and they have like that. Again, it's like that lateral knee pain, and everybody's going to tell me it's tendonitis. I'm like, no, it's like patellofemoral type stuff because you're not using the whole system because you're driving like a compensation pattern and stuff like that. And the other thing that I always tell like my athletes and stuff, because they're like, isn't it bad for like my knees to go like in? I'm like, I'll show them videos of like Michael Jordan jumping, and when he takes off, his knees are touching. And I'm like, if he's able to fly like that, then I don't think it's time for me to like tell you to like drive your knees out as far as you can just to stick a landing. Like, your body is very smart and it knows how to decelerate. So for most of these people, like, it's a little bit of like, you're going to use your adductors and you're going to allow that leg to internally rotate to create a more stable base. So that whole drive your knees out thing is for me anyway, it's a thing of the past for sure. Again, unless it's like so ugly that I can't stand to watch it and it's like a true like valgus collapse where it's not controlled, then I'm not. That's when I'll step in and cue and fix that sort of stuff and try to find more glute and hip control. But more often than not, that's not necessary. You can allow them to have like that little bit of valgus where their knee goes in and they're totally fine and totally safe. If anything, as soon as you start driving like that external rotation abduction type strategy, that's when you start to get too much compensation. So that's probably been the biggest thing for me in recent years.
So what are some tactics or strategies or ways that people can approach this for themselves? Like, what are some things that they can do to start working on? Like, let's just make the assumption, if you're listening to this podcast, I would be willing to bet that you're probably lacking hip internal rotation, adduction, and extension. Like,
right.
I've done enough table tests. I've seen enough people. Like, that's unanimously what walks in the door.
Exactly.
Right. So what are some strategies we can start to use to win this back for people? Because a lot of times people are going to be like, oh, well, I just need to like just straight stretch more. And a lot of times that's probably not the best of strategies that you could be using. Right. But I would love to like, how do you think about reclaiming this range of motion and option and control for people?
Right. So I tell kids all the time, like, it's great to have all this range of motion, but if you can't control it, it doesn't matter. So I haven't gone full FRC, but like I definitely use some like FRC principles and stuff like that. So I do a lot of like 90-90 work where you're doing like end range liftoffs and stuff like that. And even if these kids can't completely reclaim like 30 to 40 degrees of hip IR, like if they're actively feeling what I need them to feel with some of these drills, then we're moving in the right direction. So, I mean, if you're in a simple like 90-90 position, like we're going to focus on the back leg side, you're going to drive that knee into the floor. So you're going to find a little bit of adductor type stuff, and then you're going to actively try to internally rotate the foot. And again, like you can do these different contract relax techniques, you can do lift offs and holds and stuff like that, but I'm just trying to find, I'm basically again, like we talked about earlier, like I'm giving you the constraints early so that no matter where I put you, you're going to feel what I need you to feel. So we start with a lot of ground-based stuff, like that 90-90 type stuff where you have those constraints of the floor and you can feel adductor turn on. You can feel those internal rotators fire to try to lift that foot up on the backside. And then it's as simple. I've had kids squat with like a ball between their knees and people are like, what are you doing? I'm like, I need them to feel what it's like to have like a true like vertical vector as opposed to like that driving knees out type stuff. Mm-hmm. So I mean, having them do stuff with like a closer stance. And then a lot of it's an education standpoint too, because again, it's all over Instagram, the booty bands on everybody, like driving knees out to find glutes and stuff like that. I'm like, if you can't like keep everything in line with like femur acting like hammer on nail and things staying straight and allowing like that hip internal rotation to external rotation type stuff, like you're never going to find your glute. Like congrats on your 1,000 clamshells and frog pumps and stuff like that. And you feel like a burn there because you're pushing into resistance and stuff like that. But if you want like actual changes in hip strength and control and that sort of thing, like you've got to be able to go the other direction as well. So I think a lot of it's an education standpoint. And then again, providing as many constraints in 90-90 positions. And then as they gradually get more coordination of those movements and they feel what I need them to feel, then we start removing those constraints. And then we're doing more like hip cars and pails and rails and all that sort of stuff. But I mean, that's the basic one that I send every kid home with, because it doesn't take any equipment. And it's, again, I'm going to put you in the position is that 90-90 type stuff where you rotate over the back leg and then you try to lift that foot off the floor while keeping the knee down. That's been the biggest one for me. And again, like whether they're coming in with patellofemoral type stuff or they're coming in with a true tendinopathy, if they're one of my basketball guys or volleyball girls, they feel better after they do that. And it typically cleans up movement the longer that they do it.
For sure. I think one other one there that I've had some success with in the past, and it's a little bit higher up the chain, a little bit more applied. Like I found that variations on split squats are huge.
Oh my gosh, yes.
In this realm, like if you're good with coaching, cueing, and setting up a split squat, figuring out whether I want to go front foot elevated, rear foot elevated, maybe I want to drive my back foot into the wall, like simple manipulations on the coaching and cueing of a split squat, or like maybe I'm intentionally going to try to like internally rotate into my front side and do these different strategies. Like there's so many ways that you can utilize the split squat to really win back and reclaim some of this motion, this control, and then strength in different positions. So that's another one I was going to throw out there is higher up that chain. Split squats, I think, are just so phenomenal in this realm. And so people need to get past thinking of split squat as just this knee strengthener, because there's way more going on than this quad strengthener. There's way more going on than just like quad stuff in a split squat.
Exactly. I mean, if you do a split squat right, like you're going to find hamstring, glute, and adductor. Like that's what I'm after with most split squats. Again, unless I'm putting you on like a decline board and like having you like get that anterior excursion of that knee over that foot. Like more often than not, like you're saying, like I'm trying to find hamstring. I'm trying to keep knee in over like big toe as opposed to driving out over pinky toe kind of stuff to get that adductor and like that true control. And then again, like more often than not, if you're doing a split squat right, you get up, you don't have sore quads, you have a sore glute and hamstring the next day. So again, like that's what we were talking about in terms of like removing those constraints, like find that muscle on the floor when you can only activate it there. And then let's stand up, remove some of those constraints, put you in a split squat and have you find those same muscles that I had you find on the floor, and then we'll go from there and then gradually remove all constraints totally and then get into more athletic movement.
Yeah, for sure. It's funny because a lot of times on a split squat, if we set it up correctly to where on the back side, so like let's say your left foot's forward, right foot's back, and we're not going to do anything fancy here. We're not going to put heel wedges or anything in the front. We're not going to elevate one versus the other. We're not going to be pressing it all. It's just a super basic split squat. Right, that back side, that right leg if you actually set it up correctly and I stack ears over ribs, over pelvis, over knee, and I maintain that and I can go straight down, the biggest thing that you're going to hear from people is the fact that the hardest part of that movement is the back quad.
Yep.
Right? Trying to manage this really stiff back quad. Like if I do split squats, my back quad gets it's annihilated.
Oh,
right?
for sure.
If you do a good job with that stack position that we talk about. And so just you can get what you want out of it. It just depends how you decide to set it up and coach it and cue it. There's just so many tools and options with the split squat that are not being utilized effectively.
Exactly. Yeah. And then even then, like if I'm targeting the front leg, like getting people to not use that back leg is always key too. Cause I mean, just going back to the initial conversation, like the foot and ankle type stuff, like making sure they feel the pressure where I want them to feel it and that they're using that front femur as that hammer on that nail and that tibia, as opposed to just, again, they're going to compensate and try to get it done. So if you hear that split squat roll, like squeaking as they try to push themselves up, or if you see that back leg just like shaking because it's taking the load and all that sort of stuff, being able to appropriately cue and get them out of that has been huge. And then they're like, oh, that's how I work my front leg on a split squat and stuff like that.
Yeah, and then other options in this realm, like step up variations, I think are really good also. That's like a really integrated combination of foot, ankle, strength control, hip mechanics of you being, I don't really care about the going up as much as I do about getting you to the top and seeing if you can lower yourself under control and things don't just totally fall apart, right? But in the step up, another place where people really mess that one up is it just turns into a glorified like calf extension on the back. Like you watch these people do a step up and the front leg's on the box. And realistically, when you're doing a step up, your back leg should just be paralyzed. Like it should act like it's not even there. And the front leg is trying to push the box through the floor. But you see all these people where it's just like this hop off the back leg. And I'm like, well, you're not getting anything out of this exercise. Like use the front leg. And if you really do it correctly, it's hard to do with 5 pounds. It's hard to do with body weight.
Right.
But a step up's another good higher level integration of these ideas that we've been talking about, I feel like.
Yeah. I mean, that's probably like one of my end stage type thing, as opposed to like if we're not talking like true, like return to sport, like cutting and all that kind of stuff. I do like an active foot step up where I have them lift that front foot off the box. And then I tell them like, I want this to make noise. Like I want you to pop that foot down. I have them push through the midfoot. They can't let their heel collapse below the level of the box. So again, we're getting like that proper foot ankle complex stiffness and preparedness for like the step up. So that'll generate the force first. And again, like they have to drive down through the box. Like I think a lot of this comes down to like appropriate cueing and stuff like that. Like it's not just a step up. Like you were going to push that box through the floor while keeping pressure through your midfoot and not letting your knee fly 10 feet to the right. You're just going to push straight down to the floor. And then you can really start to see like a change in like RFD and like the ability to like apply that force quickly and explosively without compromising knee position and stuff like that.
Yeah, I think that's a big one for people. If they can actually learn how to be a pusher, if they can learn to push, like what pushing actually feels like, because most people aren't good pushers. They just, they're pullers essentially. If you can learn what a push actually feels like, that ends up being a massive light bulb moment for a lot of people. Like, oh, this is what this feels like.
Right. Right. I mean, I think that's always the biggest thing for me is like, I need you to, that's why I tell people, I was like, your front foot does everything, or the foot that's on the floor is doing everything. Like if you're not pushing through the floor, then we're not getting what you need to get out of this exercise. So I mean, that's the biggest thing. And that's where you get into like the coordination difficulty and just knowing where your foot is in space and that sort of thing.
For sure, man. Well, Jon, dude, this has been a fantastic conversation. I think we did a really good job, at least my own biased opinion. I feel like we did a pretty good job here hitting some broad spectrum things concerning this knee joint and being able to zoom in and talk about stuff going on at the foot and ankle, zoom back up, talk about things going on at the hip complex. And hopefully everybody listening here, I think, is walking away with some pretty good action items, some steps, some ways in which they can think about building themselves these bulletproof knees that can perform at a really high level. So
For sure.
let's close. And where can people go to find you if you would like to be found?
Sure. So I guess the easiest place to find me is on Instagram. It's Dr. Jon Gardner 23. I think there's a period.
Is that a shout out back to? Is the 23 in respect to
23 was my college number. What years were those? My junior through fifth year. So I had to throw that on there. And then doctor just sounds cool. So I spent enough money to get that degree, so I might as well throw it in my handle.
You earned it.
But yeah, Instagram is probably the best place to find me. Again, I'll post anything from like my rehab type stuff to me and my wife to my dogs. So, and my own attempts at remaining an athlete and meathead. So
I love it, dude. I love it. Well, thank you so much for coming on today, man. This was fantastic. Everybody listening, hope you enjoyed it. Be sure to go check out Jon, all the really cool shit he's got going on. Go give him a follow on Instagram. Otherwise, have a amazing rest of your week, and we'll be back and talk soon.